Dr. Chris Taylor is an OBGYN in Harrison, Arkansas. As a gynecologist, Dr. Taylor has been taking care of women's healthcare needs for over 20 years. Dr. Taylor grew up in the small community of Russellville, Arkansas, completed medical school at UAMS in Little Rock, and went on to complete his residency at one of the top-ranked OBGYN programs in the country, the University of Mississippi Medical Center in Jackson, Mississippi.
When I was a resident, the program in Jackson was ranked near the top of all OBGYN training programs in the country. Now, one of the reasons was the sheer volume of surgical cases performed, providing an opportunity for residents to get valuable hands-on experience. On top of that, some of the most difficult and challenging cases in Mississippi ended up at the university under our care. So at the completion of my training, I had already gained a level of surgical experience that typically takes gynecologists years to achieve.
At the conclusion of his residency, Dr. Taylor was recruited by a number of large practices in bigger cities, but felt the pull to return to the small-town roots of his home state.
It just felt right to build my practice in a close-knit community, not too different from the one that I grew up in, located in the heart of the beautiful Ozark Mountains. I really love this part of the state. I love the people in this part of the country, and I certainly love what I do. Not to mention, I think we are fulfilling a tremendous need by providing care in an underserved area. It's so rewarding to have a positive impact in the lives of so many women. You know, I often say, you can't fake empathy. Now, you can be the smartest physician or the most talented surgeon, but if you fail to connect on a personal level, often the patient and the physician miss out on what could be the most rewarding part of that experience, which is that physician-patient relationship.
Despite practicing in a small community, it has always been important to Dr. Taylor that his patients have access to the same advanced therapies commonly found in large metropolitan areas.
I was fortunate to come out of training at a time when great technical advances were being made in minimally invasive gynecological procedures, and we've done our best to stay at the forefront of these advances. Women continue to suffer from the same conditions: prolapse, incontinence, the need for hysterectomies and other procedures. However, over time, approaches to correcting these problems have become more effective and less invasive. Consider that 10 to 15 years ago, over 3/4 of all hysterectomies were performed through a large incision, requiring 3 or 4 days in the hospital and up to 6 weeks off from work. At that time, our practice performed our hysterectomies either partially laparoscopically and or completely vaginally, allowing patients to go home the next day and back to work in just 2 to 3 weeks.
In the years that followed, Dr. Taylor became the first OBGYN in Arkansas to perform a total laparoscopic hysterectomy in an outpatient setting, allowing patients to go home just 2 to 3 hours after surgery and go back to work in just 10 to 14 days. Today, over 99% of his hysterectomies are performed in this manner. Another great example involves the treatment of overactive bladder.
Now, there was a time when our main tool to treat overactive bladder patients primarily focused on medications that just didn't seem to work very well or had a lot of side effects. Now, as we move patients along that care pathway, we can offer a minimally invasive procedure called sacral nerve stimulation that's been proven in clinical trials to be more effective than medications. It's a simple outpatient procedure that can be performed right in our facility. Best of all, we can do a 5-minute in-office test that allows a patient to test drive it for 3 to 4 days to see how much improvement they might expect out of the long-term therapy.
After 20-plus years of treating female bladder problems, Dr. Taylor has now treated over 25,000 women, performed over 2,500 sacral nerve stimulation procedures, and is the #1 provider of this therapy in the entire world. I'd say he's made good on his goal of providing the same advanced therapies commonly found in large metropolitan areas, but doing it with a warm and personal small-town touch.